The survey results disseminated at Makerere University School of Public Health show that 1 in 3 female sex workers and sexually exploited minors are living with HIV, with the highest prevalence recorded among women aged 35 to 49 at a staggering 54%. Despite this, 90% of these women are aware of their HIV status and 80% are on treatment, closely matching national averages among women.
We've done surveys among sex workers since 2008 because we know that they are at very high risk of acquiring disease by the nature of the work that they do, but they are also then at really that risk of transmitting to other people. So it's very important to track the dynamics of disease in these populations, to inform policies, to inform programs, service delivery, to be able to deliver more targeted services.
The survey also uncovers serious reproductive health issues. Approximately 5% tested positive for syphilis, while over 1/3 of the participants were found to have high-risk HPV infections. Disturbingly, the survey reveals widespread gender-based violence. 42% of the women reported having been raped and half had experienced physical assault. Many continue sex work during pregnancy, with more than half of the women saying they sold sex while pregnant.
They are in a very vulnerable setup, and by the nature of their business and sometimes the times of operation, the people they engage with, there's a high level of alcohol use that precipitates violence.
The survey was supported by the USA, and the country's ambassador to Uganda, William Pope, was among the guests.
Today's survey that is being released is the third time we're able to use that linear data, very inclusive, particularly of key populations who have the highest incidence of HIV. And so by being able to focus in on how the virus is spreading amongst those communities and how to prevent that, it makes everyone safer and healthier.
The Uganda AIDS Commission is hopeful that the results will be of impact for their upcoming sector plans.
The most convenient prevention tool that sex workers can use comfortably without requiring the cooperation of their customer, of their client, is pre-exposure prophylaxis. We see that 84% of the sex workers need pre-exposure prophylaxis, but the current available resources can only allow us to reach 20%. So for us to support sex workers and we end new HIV infections among this key population, that we shall need additional resources. And we shall prioritize this in our new strategic plan.
Over 80% of female sex workers screened positive for possible depression, yet stigma remains a barrier to accessing healthcare. Walter Mwesije, NTV.